I thank the organizers for giving me this opportunity to present my work here. Today I'm going to talk to you about thrombosis and hemostasis because this is the session about, and I'm just going to give you an overall view of what thrombosis and hemostasis is. What happens when we have a cut and you see that blood coming out and then the blood starts to clot and then the bleeding stops, and this is the process called hemostasis. Okay. No problem. So when you have a cut and then bleeding occurs and the bleeding stops by hemostasis. This hemostasis happens by multiple mechanisms in blood. Okay. People wondered about how blood clots for a long time. So first they thought that when blood cools it clots, and then they thought when it is exposed to air it clots, and then people came up with the molecular mechanisms after they discovered that fibrin was present in the blood clot, and the precursor for that was fibrinogen. So subsequently a cascade was discovered, and Dr. Vijay Lella will talk to you about some of the frontier aspects of this coagulation enzymatic aspect of hemostasis. And then later on people discovered that there is a cellular component in the system, and platelets were discovered during that time because they're the small white particles. And that's when the cellular component was discovered, and we are going to talk about some of the platelet part of it by two other speakers, Dr. Dash and also Dr. Nayak. So when you have a vascular injury, what you see here is that the vessel, blood vessel, when blood is flowing, is ruptured, and some of the cells come out, and you can see the erythrocytes. And also you see some of the white cells, small white cells, which are platelets. And that's how the blood is coming out, but then there is a mechanism by which it stops. What happens if the blood doesn't clot? And there are deficiencies in either platelets or in the coagulation system. If the blood doesn't clot, you have large chunks of blood in the system, and these are the examples of some of the hemophilia where there's an enzymatic defect and then you see that the blood is accumulated, and that is how it is recognized as a blood problem. But if blood clots unwantedly, so in the vessel, if the blood clots so all of a sudden, then what happens? Then you have atherosclerotic plaque here, and this plaque ruptures and the platelets will accumulate, and then you have a blood clot that is formed in the carotid artery, and that will lead to occlusion of the vessel. And this occlusion leads to thrombosis, and this thrombosis happens mostly by the platelet side of it. Resting platelets are discoid shaped, and then it has some of the granules that contain either coagulation factors or some of the ADP and epinephrine which activate platelets. The first step in the platelet activation happens by the rupture, and then you have subendothelial collagen that is exposed. Platelets adhere to this subendothelial collagen, and then collagen provides the initial signal through its receptor GP6 and alpha 2 beta 1, and through that you have a signaling cascade that happens, and then thromboxane is generated and granules secrete some of the components. In the second step, the secreted component ADP and thromboxane recruit more platelets to the site of injury, and they act by their own receptors. ADP has its own receptors, P2Y1 and P2Y12. Thromboxane has its own receptor, and these receptors signal, and then the platelets get activated. Finally, when you have the clot formed, and that would lead to the occlusion in case of thrombosis, and in case of hemostasis, you have blood clot forming. So this is what happens in a carotid artery. You can see that the blood cells are floating, and there is an atherosclerotic plaque rupture, and the platelets are adhering to that. Thromboxane and ADP are released, and the incoming platelets now are activated. They change their shape, and you see how the discoid platelet is forming filopodia and going and attaching. Okay? When this grows to the point where it occludes the blood vessel, then you have thrombosis occurring, and that's when you can have heart attack or stroke. There are other conditions in which defective platelet function occurs, where thrombocytopenia, where there are no platelets, you bleed, and they have other diseases like thrombocythemia, von Willebrand's disease, Bernard-Soulier syndrome, and multiple cases where platelets defects lead to bleeding diathesis. One of the important things for the antithrombotic aspects, or because you want to prevent heart attacks and stroke, is antiplatelet drugs. And when you have an antiplatelet drug, this is what happens. So this is like a traffic situation where blood is flowing and you have a thrombosis occurring because you see that the road is blocked. And once that road is blocked, if you have an antithrombotic drug, although there is a blockade first, and it will begin to clear because the antithrombotic drugs will prevent platelet activation and the blood flows again. So the heart attack is prevented. This is a video that is courtesy of Dr. Jag. So one of the drugs that is used for antithrombotic purposes or antiplatelet drug is clopidogrel, and commercially it is known as Plavix, and it acts on the T2Y12 ADP receptor, and it is converted in the liver to a metabolite, and this metabolite acts on the P2Y12 receptor and thereby prevents the action of P2Y12 and prevents ADP activation. Both prasugrel and clopidogrel are converted in the liver, and it takes about 4 days for dosing to take full effect. And once that happens, now platelets are inactivated. The major disadvantage of this drug is that if somebody has to go into surgery, they have to wait for a while for all the platelets to be regenerated, because all the platelets are permanently inactivated by the drug. So in thrombosis and hemostasis, you have bleeding and thrombosis occurring whenever you give an antiplatelet drug and you prevent thrombosis. But when you prevent thrombosis, you also have increased chance of bleeding, and that is a side effect that you have to encounter with. And some of the aspects of the functional aspects of the platelet are going to be talked about in a zebrafish model by Dr. Jagadishwaran. He'll be talking next on this topic. Thank you.